Quantity begets quality. If you want to be really good at something, you have to be okay with actually sucking at it for a really long time. And if you want to get better at golf, let's say, you're going to have to chunk shots, you're going to have to thin shots, you're going to have to get stuck in the sand, you're going to have to take drops, you're going to have to put in the time on the simulator, put in the time on the course to get better. It's the same thing with dental sleep medicine. Screening patients, you're going to have to work at getting better at talking to those patients. You're going to have to work at getting better at the process of getting them to agree to a take-home sleep test. You're going to have to get better at the process of working with your third-party medical biller. You're going to have to get better at the process of not letting those patients fall through the cracks, better at communication, better at helping the patient own the problem. It's going to take a while. You can't just immediately hit this obstacle and decide this is not working. You have to ask yourself, why is this not working? The reason it's not working is because there's something that needs work. So focus on what needs work. Don't focus on why it's not working.